Hello students, welcome to another video lesson. Today, we shall be looking at common sports injuries and their first aid treatment. If you recall vividly, in the previous lesson, we talked about nutrition for special groups, where we defined nutrition, we defined nutrients, we talked about the classes of food nutrients and the four special groups of persons that need these nutrients most. We had the convalescents, we talked about the athletes, the adolescents, and the school children. Today, we are looking at injuries, sports injuries, causes of sports injuries, examples of sports injuries, and their treatments. Firstly, what are injuries? Have you, have you experienced damage in any part of your body before? What do you call that? Injuries are damages to any part of the body that may allow the escape of blood as a result of accidents. What's saying is that any part of the body can be injured, ranging from the legs, the head, the knee, any parts, just name it. When you engage in sports, there is every possibility that you get injured. What do you call the injury you sustain during sports? Sports injuries are injuries that occur during participation in sports and games due to accidents. Examples of common sports injuries are dislocation, strain, sprain, fracture, wound, drowning, muscle cramp, bleeding, cut, etc. These injuries can be caused by natural factors. These are factors beyond human control. For instance, thunderstorm, rain, these are natural factors, while human factors are negligence, poor lighting, lack of proper knowledge of the game. When injuries occur, there is need for first aid. What is first aid? First aid is the first and the immediate treatment given to an injured person before the arrival of a medical personnel or before taking the person to the hospital for medical attention. The person allowed to give first aid is a first aider. A first aider is one who has knowledge of first aid and uses the knowledge of first aid to ensure that life is saved and blood is stopped in case of bleeding. The main work of a first aider is to utilize the knowledge he or she has with the equipment to stop bleeding and ensure a victim is in proper health and safety before the arrival of a medical personnel. The first common sports injury we want to look at is strain, and strain is an injury to the muscle or the tendon. The tendon is a white fibrous tissue that attaches the muscle to the bone. Without this tendon, there will be no connection between the muscle and the bone. One thing you must know is that the voluntary muscles and the bones help us to move from one place to another. When there is injury to them, it is strain. The tendon that is mostly affected in the body is the Achilles tendon, which is located at the ankle. The second sports injury we want to look at is sprain. And sprain is an injury to the ligament as a result of overstretching. What is a ligament? A ligament is a white tissue that connects two or more bones together. The sprain occurs at the joint because the ligament is found at the joints connecting two or more bones together. This sprain can be caused by direct impact on the ligament or when an individual misses his or her step. A sprain, if care is not taken, can be mistaken for dislocation because it can cause swelling, which dislocation can also cause. But sprain affects the ligament, while the dislocation has to do with the bone. The third one is dislocation. Dislocation is a displacement of one or more bone ends at a joint as a result of injury to the joint. Dislocation occurs when one bone leaves its position and it changes its location as a result of pressure or impact on the joint. Dislocation occurs. And look at the picture displayed. You see the left foot, the joint at the left foot is experiencing dislocation. The bone has shifted outwardly and there is swelling. There's definitely pain and tenderness. The fourth one is fracture. Fracture is a break in the continuum of a bone in the body. That means the middle of a bone or a side, but not the end of a bone. A fracture can be open or compound, where the bone is seen on the surface of the skin. It can be closed, where the broken bone is covered by the skin. It can be incomplete or grey stick that is experienced by children, where the bone is slightly broken or bent. It can be comminuted, where the bone is pieced and there is need for surgery to correct that. First aid treatment of common sports injuries. When these injuries occur, there is need for first aid treatment. The aim of first aid treatment is to manage, not to treat completely. The first we'll look at sprain.
In this tutorial, we're going to look at the treatment for strains and sprains. Our treatment for a strain or sprain is, we use the acronym RICE. You rest the injured limb, you place ice on it, you put a compression bandage on it, and you elevate it. Our casualty here, I'm going to expose the injured limb. I'm going to use my kit bag here and I'm going to elevate the limb. Next thing, I want to put some ice on it. So when we use an ice pack, we never put it directly on the skin, we always use a bandage. Here I have my instant ice pack. I'm going to break, distribute the contents evenly. Now I'm going to wrap it up. And now I'm going to place this over the injury. I'm going to leave this here for 10 minutes to cool down the injury and also help reduce swelling. After the 10 minutes, next I'm going to use a compression bandage to put compression or apply pressure over the injury. They come with a clip. We want to discard the clip and we'll use tape to secure it. So you start above the joint, secure your bandage, you come down and we're going to do a figure of 8 around the injury and back up, and we're going to keep doing this. We're going to use the whole of the bandage and keep it good and tight. So continue doing our figure of 8. As you will notice as we're doing it, the heel is going to remain exposed, but we're keeping good pressure on the injury to keep the pressure on the joint. So once you come into the end of your bandage, again you're going to use the whole of the bandage. I'm going to secure it here around the ankle. Again, open it fully, and again I'm going to use 2 pieces of tape to secure the bandage in place. And our last part of the treatment, we need to keep the leg elevated, and as you can see it's elevated here on my kit bag. And that is the treatment for a sprain or strain.
A broken bone is the common term for what doctors call a fractured bone or simply a fracture. A broken bone is a bone that no longer has the same shape it normally does. Bones can be broken in a number of ways. This can include a straight break directly across the bone, a diagonal break through the bone. A crushing injury to the bone. When the bone is broken into several pieces or fragments. And when bones are driven together, crushing parts of one another. In addition, broken bones can be closed or open. A closed break means the skin is not broken. An open break means the skin is broken and the bone may be sticking out of the skin. Open breaks are also called compound breaks, and there's an additional risk of infection with this kind of break.
So if you find yourself in emergency situations, follow these safe steps. In the case of broken bone, call the emergency services and don't move the person unless absolutely necessary. Keep the injured area still and supported. Don't try to manipulate or realign the bone. To alleviate pain and swelling, apply ice. Wrap in the cloth without moving the affected area. Don't place the ice directly on the skin. Keep the victim calm and in a comfortable position until help arrives. If you find yourself in the right place at the right time, be prepared to save a life and follow these safe steps.
Support the injured area. Cover the wound with sterile dressings. Build up on either side of the fracture with bulky dressings and secure in place. Splint the injured area if you need to remove the patient. Secure the splint with bandages above and below the injury site.
In this health sketch, we want to talk to you about CPR, which stands for cardiopulmonary resuscitation. We use CPR when someone has collapsed and is not breathing because it can keep people alive until emergency services arrive. Learning these simple life-saving skills is as easy as ABC. All you have to remember is the doctor's ABC. D is for danger. First, look around carefully to make sure the area is safe for yourself and others before approaching. R is for response. Shake them gently by the shoulders and ask them loudly, "Are you all right?" If there is no response, you need to. S. Shout for help, as any assistance will be helpful. A is for airway. Gently tilt the head back like this to open up the airway. B is for breathing. Look, listen, and feel for signs of normal breathing. Look for normal chest movements. Listen for normal breathing sounds. And try to feel their breath against your face. Do this for no more than 10 seconds. If there is no sign of breathing, or if they are breathing in an unusual, noisy way, we need to start CPR. First, make sure that an ambulance is on its way. If you have someone with you, ask them to make the call. Putting the phone on speaker mode is useful as the ambulance service can talk you through the steps. C is for circulation. Circulation means the flow of blood around the body, and when the heart stops pumping, we need to take over this role by pushing down hard and fast on the chest. Start by placing the heel of one hand at the centre of the person's chest and interlock your fingers like this. With arms straightened, press down hard and fast, letting the chest come back up fully each time. Fast means around 2 times every second. And hard means that the chest needs to go down by about 5 centimetres. This might sound a lot, but you do need to push hard for it to be effective. If you have been trained, you can give 2 rescue breaths after every 30 compressions, as this helps provide some oxygen. However, if you have not been trained or are not comfortable, just keep going with hands-only continuous chest compressions. If someone else is with you, swap over if you begin to feel tired, and don't stop until either a health professional takes over or the person is definitely breathing normally. Sometimes we can add another step. D. D is for defibrillation, which is about delivering a shock to restart the heartbeat. Some public areas and workplaces have an easy-to-use defibrillator on site called an automatic external defibrillator, or AED. Automatic means that it is the machine that decides what to do, so you can't go wrong, and it even talks you through the steps. If there is no AED available, keep going with CPR until the ambulance arrives. That's it.